From the campus of the University of Kentucky, you're listening to Behind the Blue. I'm Cody Kaiser with UK Strategic Communications. As the University of Kentucky prepares to celebrate its newest alumni during commencement ceremonies on May 9th and 10th, each student walking across the stage carries a unique story of transformation and impact shaped by their time on campus. Earning a degree in any field demands dedication, perseverance, and countless hours of study. But the experience of UK often provides much more, equipping students with skills and perspectives gained through community engagement, hands-on research opportunities, and impactful experiences with the wider world, allowing them to go on to lead lives of meaning and purpose. Two such students are graduating this spring from the UK College of Public Health, with journeys that show how UK's supportive environment, coupled with their own initiative, has prepared them to tackle complex health challenges on a broad, even global scale. Sophia Gooden, a Lexington native, and Sophie Ciaverelli, who grew up partly in Texas and Germany, were drawn to public health for its focus on making a difference at a population level, rather than through solely individual patient care. They both held a desire to use their skills to help entire communities and appreciated the unique viewpoint public health provided in getting to the root causes and solutions of certain problems. Another cornerstone of their UK experience has been the supportive and close-knit community within the college, along with the accessibility and passion of the faculty and staff. Gooden describes the community as super welcoming and noted the ease of having personal conversations due to the college's smaller size. Ciaverelli added that the college made strong impressions on them by helping students feel they want me here, I belong here, and they are celebrating the fact that I am here right from the start. On this episode of Behind the Blue, Gooden and Ciaverelli reflect on their time at UK, their unique research and international experiences, and what's next as they prepare for graduation and embark on their future paths in public health. Sophia Gooden and Sophie Ciaverelli, thanks to both of you so much for coming in to sit down and talk about your time at UK. We're kind of doing this spotlight on both of you. You've both been deeply involved in research and student leadership and community building, and I really felt like your experiences have kind of shown the broad range of experiences that students can have when they come here to the university. So I want to start off with, and let's just start with Sophia. Let's talk a little bit about your kind of academic journey of how you chose to come to the university and what drew you to the College of Public Health. And to start off, Sophia, you're from right here in Lexington, and Sophie is from Texas originally, but somehow you both ended up here. So Sophia, tell me a little bit about kind of how you ended up here.
Yeah, for sure. So a lot of times, like growing up, UK was right next door to me. So we kind of just like always had that UK spirit in the house. And my dad worked at University of Kentucky. So I came to campus a lot. I really loved it. With University of Kentucky being so close and with COVID being so prevalent, I didn't get the chance to go on any tours or anything. So UK kind of was like, at first it was my safe option of being like, oh, like I know the campus, I know people that go here that really enjoyed it. So for me, it was kind of a backup. But once I committed to UK, I fell in love with it right away. And
you were here for a full year before Sophie got here. So Sophie, what about you? What about your journey from the Lone Star State here to Kentucky?
Yeah, for sure. I can talk about that. So I did grow up in Austin, Texas, spent most of my life there. And so I came into UK at 2022. So in 2021, when I was doing college applications, I was actually living in Germany, studying abroad for the fall. And so I was very disconnected from the idea of like viewing the universities and seeing what they have to offer. So a lot of it was just like, oh, I looked online. That school looks cool. I'll write an application. And my mother had actually grown up in Louisville, and she had suggested that I applied to UK. And so I applied to UK in December, originally as a biology major. and was accepted and toured the school and really, really liked it when I had returned in the spring from Germany. And looking at the curriculums, I kind of compared biology and then public health, which felt comparable. And I thought that public health was much more interesting because I could take what I had in those classes and apply them into the population. So that's kind of what brought me into the public health school.
Yeah, I kind of wanted to kind of get into your head about that, about what the attraction was for public health. And was there some sort of either family or mentor or family friend dynamic that you had growing up that drew your attention towards a more of the hard sciences or more of a public health field as you were kind of coming up through high school and thinking about what do I want to do with my life? Was there some sort of inspiration that kind of pointed you more in that direction?
I would say my dad has been the biggest influence on me for choosing public health. I had no idea what public health was when I first started here at UK, but I knew I kind of wanted to do something medical related, but also like help more than just one person. So that's kind of why I was like talking to him. I had a discussion with him and he was like, public health is definitely the way to go. I also got to experience the University of Kentucky's shoulder to shoulder program where they go down to Ecuador for a week, and I just loved that experience so much. But kind of going into it, I was like, I don't know if like I want to be a doctor. So going into that, I was kind of like, I could see that I didn't want to be a doctor, but I knew I wanted to help a community. So I think those two have been the biggest impact on why I decided to go into public health.
For me, it was similar, but somewhat different. So I was actually told by my parents to go into biology. They both work in medicine. My mom has a PT clinic and my father has a dental clinic. So there was always a lot of medicine, a lot of like this patient-based health in my life growing up entirely. And so biology felt like it made sense when I was applying. But in looking at it, I was kind of thinking, I'm an out-of-state student. I get a biology degree. What of it am I going to use if I decide to go to medical school? Probably not as much as this comparable public health degree where I can actually take what I learn in the classroom that day and apply it the next, like when I step out, which is really kind of what drove me to public health. And so I had to explain that to my parents and kind of sell them. Then when I got here, of course, same like Sophia, I had no idea what public health really was. I just knew that I could take what I learned in the classes and apply them to populations, which felt more fitting to me as a person as to learning on a cellular level what happens in health. So that's kind of what pushed me to public health. And then as I've continued through the degree, I fell more and more in love with public health and less in love with going into a patient-based population. And so that's kind of influenced like what I've decided to do now. So
I think that's interesting, that idea of, like you said, like I'm not studying the at a cellular level, kind of the mechanics of this from that kind of science perspective. And I'm also like, while I have an appreciation of the one-on-one patient relationship that doctors have with their patients, whether it's, like you said, physical therapy or dentistry or any of the fields of medicine you can go into where you are dealing one-on-one with patients. But this is such a bigger kind of, how can I make the biggest impact on a community that I am a part of, and where can I apply what I've learned in a way that really helps a large group of people. So once you got here and you started kind of getting into the tall grass of your public health classes, what was the experience like, and kind of how were you brought into that? How did you feel like you were received into the program, and like what was it like with the faculty and support staff? Were there impactful classes or learning experiences that you had along the way that really made you feel like I've definitely made the right choice with this?
Yeah, for sure. I mean, I think walking into public health, your first class, so we have the pre-bachelor, and then we have the like upper division, but you take these introductory public health courses when you first get into the college. And one of those first classes is, in fact, CPH 201, Intro to Public Health with Dr. Sarah Seaprick. I think now it has changed a little bit, but she was my professor who introduced me to public health as a discipline. And every week would be something different. It would be, we have 1 week that's covering infectious disease and epidemiology. We'd have another week that's covering maternal health. We'd have another week that's covering disaster preparedness. So it was like a real introduction to the variety that is in public health. And she was also always super engaging, always wanting to hear like what our experiences were with these issues so we could connect it to our own communities. And I felt like that was a really great impact at the beginning of the degree, because I was still kind of debating on, do I want to go medical route or do I want to go public health route? And that kind of helped me be like, okay, this is a good place to be. I can kind of maybe do both, depending on what I decide to do. So I think that was a really big impact in the beginning for me. And then, of course, the staff. Our college is not super big, so the staff is always super welcoming, super accommodating. I talk with them all the time. And as you go through, they get closer and closer to you. So, I mean, now applying to master's programs, it's been like, oh, who do I pick to write my recommendation letters? I have so many people to choose from, which has been really quite cool.
Yeah, kind of just like bouncing off that. The community itself is just super welcoming. Everyone's so passionate about what they do, and you can feel that when you walk into the College of Public Health. And it's just like, you walk in and like, because it's so small, you know everybody. You're like, hey, how are you? Like, and it's just so easy to have those personable conversations. You can like walk up and just talk to anyone and everyone in the college, which I really like.
Speaking to that idea of small college as far as like staff and faculty, things like that. Sophie, you took a class that was actually taught by the dean of the college, Heather Bush, which is something that not many undergrads in a lot of colleges could say. So what was that like?
That was a really, really cool class. That was epidemiology, or CPH 410. It was epidemiology, people, places, and policies, I believe, or politics. And it was actually taught by the dean. It was also taught by Sarah Seaprick, who was my first professor in the College of Public Health. And it was taught by Dr. Hall Graham, who is, she's a professor in the grad school doing policy work. And so it was co-taught by 3 different professors, which is a really cool experience because they were all experts in certain aspects of epidemiology. So we had Seaprick, who would do everything that was more qualitative analysis based. So thinking about, why do people choose to smoke cigarettes? Or what are people's experiences with opioid addiction? And kind of those more personal experiences and how to quantify those. And then we had Dean Bush, who is a biostatistician by training, and she could teach us these more quantitative analyses and ideas of like, I'm going to give you, I remember clearly she did this for me. She gave me I don't remember how many pages, it was a many page document on a summary of all measles outbreaks in the European Union from like 2021 to 2023. And I had to make a 1-pager that was informative to any population about what the most important takeaway is from that document. And so that was Dean Bush's main focus. And so it was really fun because she knew my interests. And so she tailored it to be like, okay, Sophie, you want to work, or like you're interested in Europe, you're interested in all of these things. Here's a European Union document. Make it sense to everybody. And so that's kind of what she did. And then Hall Graham's main focus was in policy. And so she would be like, okay, this week we're doing tobacco policy. You need to write a 1-pager to a state legislator advocating for a certain bill. And she would ask us to like make hot takes or make things that might be controversial to do. So I would be like, okay, I'm going to advocate for like vaccine mandates for HPV to enter high school. And so I would write up a whole paper on like why we should do this, what the evidence is that exists, and what the next step should be. And so it was kind of a really cool cumulative experience, because when you walk into an epidemiology class, you don't expect to do all of these different things. And because we had these 3 expert professors, we were able to do a lot, which was really awesome.
That's fascinating, that idea of having 3 faculty members in one class and being able to kind of gain knowledge from such different areas of expertise. But Sophia, maybe you can speak on this too, like the college in general, the class sizes are somewhat smaller. And so I would guess that there was a lot of opportunity to get guidance from your faculty in a way that was very focused on you and focused on such a small group that you were able to have a better, closer rapport. And I would guess that may also open up opportunities for leadership development, things like that.
Yeah, for sure. So I'm the social media chair in the Students Public Health Association, and I kind of got there through like mentorship and through being close with professors and just being able to like speak in class and like get like guidance in class and then all the way leading up to like a position in the SPHA. So I think it's really nice being close with your mentors because you never know like what doors can open for you. And so I took a few classes that were first time classes. So I took an ACEs class and a substance use class. And like I was saying earlier, all these professors are so passionate about what they were doing. And if you put in that like passion as well, then they'll like, I don't want to say like help you get to where you want to go, but they will give you the resources that you need or like anything like outside of class, like opportunities and just different like job opportunities and shadow opportunities, which I think is really fascinating.
And kind of to add on to what Sophia was saying, I'm a student ambassador for the College of Public Health. And that has also allowed me to kind of understand and network a lot with what happens within the college and also like making the college known to people who don't know what public health is in the community or people who are, interested in coming to UK. I'm able to kind of show like that epidemiology class that I was speaking about had, I think, 14 or 15 people in it and 3 professors. So it was super, super, super tailored. And kind of being able to show that to people who might not know what public health is, that like it's really quite an interesting discipline. And it's really for people who want to have these really close connections with their professors or these really interesting opportunities for leadership or this other focus on what health is for different populations. Like that's really kind of what public health is and what our college really aims to show a lot of times. So.
And I think having smaller classes is also really nice, not just on the student to professor aspect of it, but also student to student. I have grown so much with like my cohort and like gotten so much closer to the people that I take classes with because of how small those classes are. And it's just building up for like discussions, and we derail all the time because we get into some really good conversations.
Excellent. One of the things that I talk about often with people that I interview, and one of the things that I know that we really like to emphasize and stress, especially with student recruitment, with high school students who are looking at the university and they're thinking about maybe wanting to come here across so many different colleges, we very much emphasize research and student involvement in research from the moment students arrive on campus, that there are opportunities for undergraduate students to get involved on some level with research. And we talk a lot about transdisciplinary research between colleges that and disciplines that you wouldn't necessarily imagine working together, like someone from the arts working with some group on cancer research or that's a variety of things. You've both worked closely with Dr. Ann Ray and on Dr. Ray's research team. Can you talk about that experience and kind of how that opened up and then what you've learned from that?
That's been a really cool experience for me because it was kind of a really great opportunity to get involved almost one-on-one. Well, Sophia and I met, I think, in Dr. Ray's course, but it's a course that's designed to be like you, maybe another student, and this research team all working together on whatever project they're doing, whatever they need you to help with. And it's been a really interesting opportunity to get involved with Dr. Ray's a behavioral health researcher, and she works in substance use, which before going in, I was kind of like, behavioral health is really interesting. Substance use, my focus, maybe not. But, it's an opportunity to kind of learn what exists in that field and what's happening in that field and the diversity of it. And so it's actually been really cool to kind of learn some of the basics of research, because I'm interested in going to research as my career. But a lot of times you feel like they just throw you in and they're like, okay, learn, go do this thing, and you're going to make a project on it, and it's going to be okay. Dr. Ray is very focused in like, these are the methodologies. These are how you do these. These are why they're important. And so in addition to helping her with her projects that she's doing, we've had the opportunity to kind of learn these foundational ideas about how research is conducted, how certain other research is conducted, how qualitative research what methodologies exist for qualitative research, and so on. And so it's been a really kind of interesting opportunity and a unique opportunity to kind of get this one-on-one or really, really tailored course on like how to be a researcher, how to conduct it, why it's important, and kind of broadening your horizons on what exists in public health research.
So really, truly working kind of hand in hand with the curriculum itself in an effort to help you understand the methodology, understand what public health is all about, helping shape goals, I guess.
Like you mentioned before, the university is really like passionate about doing undergraduate research. And coming into the university, I knew I wanted to do research some way, somehow. But it's very overwhelming, like to try to find a mentor and try to know what you're passionate about. But again, since the college is so small, they have a lot of good resources, a lot of opportunities. And we're actually both in the CPH 395 course, which allows us to take an independent research class. And then once you take that, then you can actually get a fellowship with it, which I think is super interesting. And I've learned a lot about research. I learned what I like and what I don't like. I've actually gotten to present, I think we're going to 4 conferences. And then I actually just came back from the National Conference of Undergraduate Research, which was super cool. So I've learned a lot over my experience. And then it's also just a good way to have a mentor and to be able to not only to expand outside of research and just have that mentorship. She's allowed us a lot of creativity with what we want to do on the project, which I've also really enjoyed.
Mm-hmm. So, I mean, to add on to that, like Sophia and I both have these kind of tailored projects that both her and I are working on, and we sometimes help each other with. Dr. Ray has helped facilitate that. So we both have created, like to talk about our projects, we've both created repositories. I created a marijuana repository of all of the existing nationally representative surveys that cover any question that has to do with marijuana usage or marijuana as a topic. And then divided that up into the domains of like time, so the context in which it was asked, of like when, and then also the content. So like if they were using, like when did they use it? When did they start using it? Like pregnancy was, I think, another domain that we discussed about usage, and then quantity and how it was used, and particularly in marijuana was very interesting. Was like, okay, are you like smoking it, or are you taking it as like an edible or anything? And so it's kind of been an interesting way to see like, okay, if I wanted to do qualitative research in the future, what questions exist and how are they asked and why are they asked that way and what populations do they target? And so that was my focus. And I don't know, Sophia, if you want to get into yours like real quick, but.
Yeah, mine was basically the same thing, but with alcohol. So we split it up in 2 domains, time and behavior, and then looked at 5 different national surveys and compiled it into a repository.
While you're doing your undergraduate work, while you're helping with research, you also had ample opportunity to be involved in a variety of other places and opportunities across campus. Sophia, you've been as you mentioned, leader in the Student Public Health Association, but you also took part with Dance Blue. And how did those experiences, or how did that experience in particular, because you've already kind of mentioned the association, but how did you get involved with that, and kind of what did it teach you from that as well?
So I'm from Lexington, born and raised. I went to Lafayette right down the road. So Dance Blue has always been a big passion of Lafayette. And so it kind of just like transitioned into my time here at UK. I was like looking forward to, right when I went to high school, I was like, this is something that I want to do if I went to UK. So I think just like because it is student ran, I think because there's so much passion in it, it just makes the experience like 10 times better. And so getting that experience is just like, it's built my community with so many of my friends, because you are spending 24 hours together, while also like standing and not sleeping. So you really get to know each other when you're doing Dance Blue. But it will be something I talk about forever, because it's just impacted my time here at UK.
I would think too that because of the work that it does with the Children's Oncology Clinic, from an administrative kind of view, it's just one more thing that you can look at to say, I had experience with this as well. So as you move into more of whatever area of public health you're going into, it's just one more building block of what you've had experience with to understand kind of how the mechanics of that work, kind of from a bigger administrative kind of overarching kind of way as well.
Yeah, absolutely. I think it's really cool that it stays local. Like, it's right here at UK. And also, like, just being able to like meet the children that actually go through the clinic is also like just super special. And it really puts on your heart why you do what you do.
And then, Sophie, you had a pretty incredible internship experience with the German Cancer Research Center. Were you always thinking about an international kind of, because I know you said, you were already looking into UK from another country, coming back to the States for school. So your experience level, as far as that goes, you were already open to that kind of opportunity. What was that like, and how do you feel like that influenced what you were doing and then also your future plans?
So the internship I did at the German Cancer Research Center was super pivotal for me. I set that up with a lot of support from the College of Public Health, but it was entirely independently driven. And so I reached out to, I was interested in doing research for a summer. And so I reached out to a program that was going to give me a full stipend to study abroad and conduct research. But given the nicheness of public health, they wouldn't fund the public health projects. And so therefore I couldn't get into that program. But I knew that I still was interested in going to Germany, as I had studied abroad in Germany before. I was also a recipient of the Congress Bundestag, or a member of the Congress Bundestag Youth Exchange Program. And I had been taking German since I was 13 years old. So the idea of going to Germany was set in my bones as something that I wanted to do. And the opportunity to conduct research and work to further my career while doing this big passion of mine was the perfect mirage in between these two passions. And so the German Cancer Research Center, I ended up working with two groups. One was preventive oncology, which has now become primary cancer prevention. And the other is in clinical epidemiology. And in both of those groups, I had ample experiences of learning coding to do data processing, but also to go out and recruit patients and to go work in the lab. And I would meet with my coworkers every day, and we'd have lunch together, and we'd talk about my time in America, and we'd talk about stuff happening in Germany. And the longer I stayed there, the longer I conducted this research, the more I realized that I really liked that aspect. I really liked the idea of working in cancer research in Germany and working to do prevention to make sure that less people have to go through treatment and less people have the experiences that are so detrimental to their lives. And in looking back at what I had in America, I was okay, I could go back to Texas and study medicine, or I could stay here and do cancer research, and kind of think about, okay, do I want to focus on the individual or do I want to focus on the population? And after being in public health for so long, I was I really care about the population. So that was really pivotal in making that decision for me of okay, I think I want to go public health route. I think I want to go into cancer research. And so now I've been, I was able to kind of excel through the bachelor's of public health after dropping the last pre-med requirements I had, and I'm able to graduate a whole year early and have been working on master's applications to study in Germany.
Just the cultural experience of it as well, it really kind of seems like it opens such doors for yourself to just be more of a global citizen and more aware of things that are going on a bigger scale around the world. You both have a background in German, is that correct?
Yeah, so my mom's actually like born and raised in Germany and came over here. So I still have family over there and we go visit or try to visit every year.
Was it like this weird serendipity when the two of you had this class with each other and met each other and discovered that you had some of these commonalities?
Yeah, that really was.
It's been really funny. Yeah, we did, because we didn't know that. And she talked about Germany or something. And I was like, wait, you know Germany? I studied in Germany and I did research in Germany. And so it's been a fun time of like, she'll have German homework and I'll be like, oh, let me look at that. So it's kind of a funny coincidence that that's what's happened. We're Sophie and Sophia, and we both have public health, or we're both doing bachelors of public health, and we both have roots to Germany in some way. So kind of a funny series of events.
Yeah. I want to ask a little bit about moving outside of your academic career and outside of research and outside of international study and things like that. Talk to me a little bit about just your overall experience as a student. And, you both were in high school during COVID and during all of the difficulties of attending school and being in a kind of a community, and that definitely had an impact on your high school careers. Sophia, as you got here, the university was kind of coming out of, masks and things like that. But definitely, and from a public health perspective, I know that you've probably had these conversations in class about the impact on a population from a health perspective, from a mental health perspective. But once you got here and you were part of this kind of bigger community, what was, outside of these things you were studying, what was your experience like as far as the friendships you were able to cultivate on campus, maybe some of your favorite places and things to do on campus? Like, what was the college experience like for both of you?
That's a really good question. I will say, kind of just going back to what you were saying about community, I think community is so important, whether that be the UK community, the public health community, or just like what you're interested in community. But just really like relying on those people and like checking in on them and them checking in on you. I think that's what has helped me go through the motions of college, because college is crazy. College is, ups, downs, turns, everything. It's so busy, and you need to take a moment to like step back and actually be like, you only have 4 years. You got to make the most of it. So just in my free time here, I like to play like pickleball and then just like go to the gym with my friends and stuff. But just really making the most of your time and making sure you lean on your community is the two biggest things that I would say.
Mm-hmm. I think that exactly what Sophia said, community is a really big thing. And I mean, coming here as an out-of-state student, I had no community going in. And so I chose to live in the International Village Living Learning Program, which kind of, played into my international relations interests a little bit. But I was like, okay, if I go into a program like this, there's going to be all sorts of people that are coming from all over the world that are in the same boat as me of not knowing anybody and still needing a community. And so that first year we were incredibly close, and I was able to create a ton of friendships that have lasted throughout my time here. And then, being in the college and having these small classes, I've been able to get really close with my classmates. Also being an ambassador, getting close with my colleagues that are also students here and helping support them through what they need. Because of course, we as students need support, but also there is a level of us supporting each other that also helps to strengthen those bonds. I was really involved in the German club on campus starting in the fall of last year. And that is what reignited that passion to go to Germany for me. And that is what drove me to cold email the German Cancer Research Center to try and get an internship for a summer. And so I feel like there's a lot of people here that are super encouraging. And if you have your passion, there's people here that want to see you make the most of it and make what you want out of it. And so I think that the encouragement that lives on this campus is kind of what's driven me to do the things that I've done and now graduate a whole year early it's given me the motivation to do those things. So
I know that there are just a massive amount of student organizations. I mean, hundreds of student organizations to kind of find your community and be a part of. I do find it interesting and encouraging that the college itself kind of helped foster some community and support for their students. You've both been regulars at, public health events like Public Health Halloween, National Public Health Week, things like that. Has there been a moment when you really kind of felt that, the college has that "you belong here" message, that sense of community? Has there been a moment when you really kind of felt that and you saw that, like, this is active across not only the classroom, but also social events and mentorships? I really feel as a student like they have across the board in all aspects kind of made me feel like I belong.
I would definitely say the Halloween, the CPH Halloween. You just really get to see a different side of your faculty. I remember, I think it was last year, Dr. Seapreck dressed up as Miss Frizzle. So you really get to see like not only the serious side and like the passionate side of your faculty, but also like the fun side and the goofy side of your faculty. And we do like a chili cook-off, and it's just like, it's so much fun. Like, you just like, it's community outside of the classroom. And I don't know, I love CPH Halloween. It's one of my favorite events they do.
Mm-hmm. I think CPH Halloween is a really good event. I think National Public Health Week, this is currently, as we're recording this, National Public Health Week, by the way. It's also a really awesome time to be involved in the college because it's just this massive celebration of like, we exist, we matter, and let's celebrate that. And so I think that that's a really great sense of belonging. So a couple days ago, we did a march across campus, and she does social media for the college on occasion. She was like running up to people with a camera and was like, "For a pin, say I love public health." And so everybody was saying that they love public health and getting pins, and that went on the social media, which was really cute. And then I think like Pump It Up is a really big event for feeling like you belong. It's the induction ceremony for new students coming into the college. And we have speakers from my Pump It Up when I first was a freshman, had the state epidemiologist, it had the founder of the college, of course, our dean, and all of them there. And they're all there to just celebrate the fact that you want to be involved with this. And if you're new and the member, they have these cards, and you read down like basically your vows as a public health student, a public health practitioner, of what you vow to do. And they honor that. And so I think that that's a really awesome event for first years to be like, they want me here, I belong here, and they are celebrating the fact that I'm here. And that kind of is a good encouragement moving forward for the rest of the time that you're there, is knowing that like you signed this vow, you're a public health student now, and we're happy that you're here.
Yeah, and with the Pump It Up event, they also have banners, so they'll put that in the college to remind you that like, oh, you signed this, like, you're responsible. And then we also did a Jon Snow play, so again, seeing the goofy side of the faculty, they all dressed up and kind of went through like the Jon Snow era, I guess.
And yeah, for those who don't know Jon Snow, he's the first epidemiologist. So he discovered like what was causing a cholera outbreak in the UK, and linked it to a pump. And the pump, he took the handle off, and therefore the cholera outbreak weakened. So that's why the event is called Pump It Up, is for Jon Snow taking the pump handle off and ending this cholera outbreak.
You take part in Pump It Up as an incoming student into the College of Public Health, but then you go back each year as you move up in class level to become a part of that. I think that's interesting too. As you're coming in, you see that older classmates are there to support you, and then kind of on a reciprocal level, you're there to be able to support incoming new students who are coming in. And I can really see where it really fosters that sense of community. Is it easy for you to see at this point, like the relationships that you've created with your fellow public health students, that foundation's been laid, that you can see that you're going to be able to stay in contact with with these friends that you've made, these relationships that you've built once you're out of the university and on to bigger and better things, as alumni, you're going to be able to kind of call back on that?
Oh, for sure. I would consider some of my public health friends like my best friends. Like we talk every day, whether that be about class or something silly going on. But yeah, I definitely see myself like being lifelong friends with these people.
I think that, I think our cohort is really close, and it's been interesting because I've kind of floated between two cohorts moving forward through this degree. And so I can see the people that I started with as a freshman that are juniors now and see that like they still have, like I've had some experiences that they haven't had yet. And then also be with my like the senior cohort and being like, wow, in like the 3 years I was here, I went from not knowing any of you to like, I can call you up when I'm having a bad day and be like, help me get through this, like give me some light here. And they'll do that. And even then, like with the faculty, I have plenty of faculty that are like, let me know what happens with your life. I want to know like what keeps going. Let's stay in touch as you continue forward. So that connection kind of is through the whole college. And of course, our students have different relationships than we do with our faculty members. But I think that the idea is still there that everybody cares about you and everybody wants to see what happens to you and support you and celebrate you through all of that.
As a student who is out of state, what have been some of your favorite parts of just Lexington and Kentucky in general? And let me also ask Sophia to chime in as well. As someone who grew up in Lexington, grew up in central Kentucky, how did your time at the university kind of change your perception of Lexington, the city you grew up in, and give you a different perspective? Because I often hear from students who grew up here, they knew that the university was here, but they never, until they were on this side of it, it became a completely different kind of experience of the city itself. So for either of you, what was the experience like?
It's been really interesting living in Lexington. I come from Austin, Texas, which is a city with over 1 million residents now. And throughout my whole life, that city has exploded. Like it was nowhere near as big when I was a child, and now it's just rapidly growing. And so it's been interesting to be in Lexington because I came from Austin and I was like, wow, this is a small town. This is kind of nice, kind of like communal. And like talking to my classmates that are from rural Kentucky, they're like, this is the biggest city I've ever been in. And I'm like, interesting, because it's just it's different. It's like it's very diverse, kind of how we all view this city. For me, my freshman year, I was really bad about leaving campus. And so I decided like in the spring semester, okay, I'm studying a lot. I'm going to change the places where I study. And so I was able to kind of find some of my favorite cafes in the area and be able to support these cafes. And I think my favorite is Kenwick Table because it's in a neighborhood community. For those who haven't been to Kenwick Table, it's basically a house that they gutted, turned into a cafe, and there's like residences all around it. And so you'll see people like walking down the neighborhood with their kids, hop in for a coffee, walk back out with their kids. And so since I'm an out-of-state student, I don't really get that like not college life very often. And so it's been really nice to be able to go to this cafe and kind of be like, oh yeah, this is how the rest of society works. I see now. And so that's been really interesting. Austin has nowhere near the horse focus that Kentucky does. And so every so often going to Keeneland has always been really exciting because it's a very niche Lexington experience that I always make sure to take like international students to, or to go myself, because you don't get that very many other places. So those are probably my two favorites.
Yeah, well, growing up in Kentucky, I've kind of had a love-hate relationship. I mean, you live in a place for 21 years and you're kind of like, I want to get out. So that's kind of how I was feeling even before I came to the university. I kind of was like, I want to go out of state. I'm not going to Kentucky. But over the 4 years, I've really grown to love Lexington. I'm actually moving away for grad school, and I'm kind of like, wait, I'm kind of going to miss it here. But kind of what Sophie was saying, like taking like out of state people or like international students to like places like Keeneland, I'm like, oh, it's just Keeneland. But like for them, it's like, it's Keeneland. Like it's exciting. And so like just seeing their experiences and like kind of living through them to see Kentucky for the first time, it's like really interesting because I'm like, oh, that's just Keeneland. Like that's boring. Like we don't need to go there. But it's really interesting to see like how excited they get. So I think that would be kind of like how Lexington has like kind of shifted for me.
You mentioned grad school and moving away for grad school. I wanted to ask both of you what next steps are for each of you.
So I'm planning on I am doing a Master's of Public Health and Global Health. I kind of wanted to focus on food insecurity and water sanitation. And I'm moving out to the Washington State to go to University of Washington in Seattle.
I'm aiming to do my master's in Germany, but their schedule is a little bit different and their semesters don't start until October. So the timing of which I will know my acceptances, we have not arrived to as of yet. But my hope is to continue my public health education and broaden that. I'm currently working on getting another internship for the summer in Germany. And yeah, aiming for a master's in public health. Following that, I'm hoping to do a doctorate and go into cancer research, particularly in prevention. So those are the future plans for me.
I want to ask, as you are reaching this point where you're wrapping up your college career, you're getting ready to graduate, you're moving on, and you can reflect back maybe on the time here and what you've learned and how you've grown as a person. If you were speaking to a high school student or a group of students who were thinking about majoring in public health, what would you tell them about this path and specifically about UK's College of Public Health program?
I would say it just truly feels like a family because, I mean, I had to take Gen Chem. I had to take like bio. You walk into that class and it's overstimulating. You have like 200 people and you kind of just like lose track of what's going on. But here you actually have people you can talk to. You have other students, whether that be the same cohort or older kids as you. And it truly just feels like a big family. Anyone is willing to talk to you and everyone's so open-minded and can have conversations with you.
I think the big thing with public health at this college is, of course, we have this wonderful family, but even just understanding the discipline, like it's a whole different perspective. It totally changes the way that you look at the world around you and the way that you look at health as a whole. And so I think if I were to talk to a high school student, I work in recruitment also on occasion as an ambassador. A lot of times I just say, if you know that you care about populations and you want to know how, for instance, social determinants of health, like your location, your access to food impacts your health, that's a really big thing. And the content that you learn here, the education that you get within the College of Public Health, you can take and use anywhere, whether you decide to go into healthcare as a physician or you decide to go into research as a substance use researcher or anything in between. There's something here for you, and there's a lot that you'll be able to take with you for the rest of your life. And so just be open-minded. Don't be afraid to ask for what you want, and people will help you get to where you want to be.
And I will say a lot of pre-med students are so quick to just choose biology and stick with it. But having that public health background can really give you something that not a lot of biology people can have. Because again, like Sophie was saying, it really opens your eyes truly to how to fix a certain problem. So I think if you are public or pre-med and leaning towards going biology, maybe look into public health.
I'm sure you have lots of family who are going to be here for commencement to watch you walk across that stage. Final question I want to ask, maybe talk a little bit about that excitement among your family and friends, but then also, what are you most proud of from your time here in the College of Public Health?
Honestly, just how far I've come. as a little freshman, I was, sitting in the back of the classroom, not really speaking. And then now I'm sitting here on a podcast talking about all the experiences that I've had as a public health major. So I think just the growth that I've had in my 4 years at the university is what I'm most proud of.
I would say something similar. I think the growth and the openness that I've developed has been a really big thing, and being able to kind of foster the drive that I have is something I'm super proud of. I mean, I'm incredibly proud of the fact that I'm able to graduate a year early. I'm incredibly proud of the fact that I was able to study and research in Germany at such a prestigious institution like the German Cancer Research Center, and have a seat at those tables even as a bachelor's student. And so I think that those are things that I'm really proud of, and just knowing that like I came in very shy, not really sure like where I fit in, and I'm leaving like knowing that I'm valued in the college, I'm valued at these panel tables to determine the next big research project. And that's something that I could carry with me, and just knowing that that's something that I've developed even in 3 years. Like, what's next, It's something to be proud of, and to kind of look forward to continuing to foster as I continue on through life.
Wonderful. Well, I want to say, Sophie Ciaverelli, Sophia Gooden, thank you so much for joining us today and for talking about everything that you've contributed to the College of Public Health, and what you've gotten out of your experience, and how your stories remind us what is possible for students who are empowered to explore and lead and grow, not just in the classroom, but really across the globe and in your community. So congratulations on upcoming graduation, and we can't wait to see what is next for you as you move out into the world.
Thank you.
Thank you very much.
Thanks for listening to Behind the Blue. Behind the Blue is a joint production of the University of Kentucky and UK Healthcare. For more stories about UK and UK Healthcare, visit uknow.uky.edu.